Hey, friends. Welcome to the podcast. The patient's voice, does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a safe space where we will discuss tips, hot topics, provide resources, have guest speakers who are experts in the healthcare industry, or real patients sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I am your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board-certified patient advocate. I have a passion for patients. Let's be the change together. Hey everyone, and welcome. So this is going to be part one of a two-part series in which I want to cover some of the basics of healthcare. And I apologize if this is boring to some people, but knowledge is power. If you don't work in the healthcare industry, you don't know some of the buzzwords, or we call them the alphabets, where we use a lot of acronyms, and you just don't know what you don't know. And, the point of this podcast is to bring awareness of how broken the healthcare system is. A lot of people do not know the facts, or they think a preventable medical error will never happen to them until it does. I told you that this podcast, I was going to be very open and transparent so that you, the patient, can stay safe in any healthcare setting. Now, I'm going to pause right there and explain what the healthcare setting means. So from the minute you're born until your death, we're all on a healthcare journey, whether it's in the delivery room having a baby, mental health, a dialysis center, chemo, telemedicine, emergency department, rehabs, assisted livings, if you're in the hospital, if you're having outpatient surgery, urgent care, those are all considered the healthcare setting. So what is a preventable medical error or a never event? Well, a never event is something that should have never happened. And a preventable medical error is an error that could have been prevented. Now, I want you to know that preventable medical errors, they don't discriminate. They don't have a race. They don't have wealth. They don't have age. They don't have a political party. No one is immune from having a medical error happen to them or their loved one. And if I'm going to continue to be honest with you, you should not trust the healthcare system. Now, I am not saying do not trust your doctor. I'm saying you do not need to trust the healthcare system. And why do I say that? It's because the healthcare system is broken. It's complex. So I'm going to go over some very alarming statistics with you. And most people don't want to hear this data. They'd rather not hear it or think about that it's going on. They just assume and trust the healthcare system. So like I said, I want you to be educated, because my job is to, through this show, I hope I'm empowering you to have a voice. So preventable medical errors are the third leading cause of death after heart disease and cancer. Now, y'all, these are preventable, and an error is not a disease. It's not a health condition. Nearly 1 in 4 patients that are admitted to the hospital in the United States will experience harm. This has to stop. And Secretary Becerra, who is the head of the U.S. Department of HHS, he stated the following: we're losing pretty much an airline full of Americans every day to medical error, but we don't think about it. The worst part, it is avoidable. Y'all, that's roughly 550 people a day dying for something that was avoidable. Again, I apologize if this angers people or if it's boring. But as a patient advocate, I'm bringing this to you, the truth, because I'm seeing this firsthand. as I work with patients as boots on the ground. I'm just going to share with you what I know. This is real. And the worst part is I believe the numbers, the statistics I just told you are higher than being reported. Patient safety is the worst that I have seen it in over 20 years. Which brings me to, what is patient safety? It's a public health crisis, y'all, just like COVID. The difference is no one is talking about this crisis or things are being covered up. Most people do not even know what patient safety truly means or what it entails. For example, I was speaking to some med students and they didn't know the meaning of patient safety as it relates to you as the patient. And to be honest, that frustrates me because I believe that patient safety and empathy should be taught in every med school. But that's for another day. Patient safety basically means preventing harm. And harm could be medication errors, sepsis, falls, surgical errors, blood clots, diagnostic errors, which we're going to talk about in part 2, because not only is that out of control, it is on the rise. And there's a study that says that a misdiagnosis kills or permanently disables 795,000 people a year. Now that's alarming. So why am I telling you this? Well, I heard this amazing quote from Dr. Don Berwick, and he said, "It's time for doctors to get off their pedestals and patients to get off of our knees." Patients need to stand up for themselves. Y'all, healthcare works for us. We do not work for them. Get engaged. Reach out to me. Let's tell your story. Speak up and demand accountability to ensure you get the medical care you need and deserve. Reach out to me. Share, follow, listen to more episodes, because my goal in this podcast is to give you a voice, educate you, and empower you from a preventable medical error occurring to you or your loved one. I am going to leave you with a quick client story that had an unfortunate end. Now remember, preventable medical errors are the 3rd leading cause of death in the United States. This patient's death was preventable, and we asked them to disclose that on the death certificate, in which they denied us. So I had a client that lived out of town, and they were on an event. And I'd asked the healthcare team, were they rotating? Because if you're on an event, you're to be rotated protocol every 2 hours not to get a wound. And that's what I was worried about. And they said, "Oh, yes, we're following protocol. The patient's being moved every 2 hours. Don't worry about it." Well, because I don't trust the system, I obtained, I knew in the medical records, they took pictures of if there were wounds, and they had told us that the patient had a tiny scratch on their face. And so when we got the picture of this scratch, it was a wound, and the wound was so big, my thumb could fit in the side of this patient's head. Well, back again, because I don't trust the healthcare team, I called to get their vitals and noticed an extremely high temperature, and white blood cell count was through the roof. And so I immediately reached out to the healthcare team and said, "Look, because of the picture, I'm worried about an infection or sepsis." They got angry at us for asking questions and demanding care, ignored us, dismissed us, even stopped answering the telephone at certain times. And do you know that 2 days later, this patient died of sepsis? Is this transparency? Is this patient safety? Was this facility listening to our voice? No. I want you to know that all the statistics and anything I talked about in today's episode, the resources are available in the narrative section. But that brings us to the end of this episode. And as always, thank you so much for listening to the patient's voice. Does it matter? I hope you've enjoyed the show and found it very informational. I would love if you would subscribe, like, share, follow, comment, respond to some of the forms that I put in the narrative section. And, reach out to me as an advocate if you need any assistance. Be sure to come back next time because we're going to do part 2 of this series. But until then, I'm Krista Hughes, and I have a passion for patients. Let's be the change together.